Hello and welcome everybody to the UVA Medical Center Hour. I'm Justin Mutter, Director of the Medical Center Hour program of UVA's Center for Health, Humanities, and Ethics, which, as many of our participants long time have been know, has been running for over 5 decades now. We're delighted to see so many of you joining us today, and I'm sure more will join as we get started here for this critical and timely discussion. This is our inaugural event for the 2021-2022 academic year, which our center has the privilege of co-sponsoring with the Compassionate Care Initiative of the UVA School of Nursing. So a brief word about the structure for today's event. All of our panelists have completed conflict of interest statements and have no disclosures. Please also note that continuing education credit can be claimed for today's event. We invite you to follow the directions at the bottom of the handout, which is posted on our website, or which you may have received in your email in order to claim continuing education credits. When the time comes to enter into the question and answer portion of today's event, please send your questions through the Q&A option on the bottom of your screen and Zoom. You can enter in those questions in at any point, and we will monitor those. And when the time comes for the Q&A opening to the audience, we will sort through those and have a full discussion. So today's topic needs no introduction. Whether or not we are clinical practitioners, our ever-expanding lexicon of terms to describe what nearly all of us have experienced over the last year and a half and prior to the pandemic reflects the depth and breadth of our collective struggle. There is the negative language: burnout, moral distress, moral injury, a sense of depletion, compassion fatigue. And there is the positive language in response: self-care, mattering, resilience, structural justice. But what does all this mean? How should we direct our language and our cumulative action to build communities of meaning, of purpose, and of enduring care for one another? We are honored to have a team of panelists today whose expertise and experience can guide us through these difficult waters, not just in nursing, but throughout all of our professions. And to start us on this journey, I'll now turn things over to our moderator and panelist, Dr. Lili Powell, the Julie Logan Sands Associate Professor at the Darden School of Business and Professor and Director of the Compassionate Care Initiative at the UVA School of Nursing. Lili.
Thank you, Justin. That was a beautiful introduction. Let me share my screen. As Justin just pointed out, the present pandemic has made all too clear for us the nature of clinician burnout, and also has exposed the breakdowns in systems. We want to begin today by acknowledging clinician suffering and the controversy that has really begun to unfold and maybe even come to a head at this point in time. There's no denying that the pandemic has made vivid for us something that we in healthcare have known for some time, and that is that clinician burnout is rampant, that staffing shortages cause great stress on individuals trying their best to provide compassionate care under arduous circumstances. We understand that clinicians often leave work feeling like the walking wounded, having endured numbers of stresses from overwork, from moral injury, and stress. We feel for you, and we want to help to advance this conversation. In the next little while, I'd like to share with you a few thoughts about the conversation as it has unfolded. This is actually a topic that has been of great interest to us at the Compassionate Care Initiative for some time. Since 2009, when we first got started and Dorrie was really our founder, we have been thinking about clinical care as well as patient care. And as you'll see on the screen here, it's been part of our mission from the beginning to pay attention to the ways that we can cultivate a resilient and compassionate healthcare workforce. We envision safe and high-functioning healthcare environments where all staff can embody compassion in their work and in patient care. Now, this vision of ours has actually unfolded over a period of time. And as a scholar of rhetoric, I am very interested, this is my I guess, life's fascination in things like the history of science and controversy, in the way that social movements evolve, in the ways that collective narratives change over time. And if we look at this chart that was first introduced by the National Academy of Medicine in 2018, we could almost tell the story of CCI and our own evolution in our thinking. In the very early days, we were focused mainly on the center part of this diagram, patient well-being, the clinician-patient relationship, and clinician well-being, because we were focused on providing compassionate care at the end of life. Because of the stressors that are involved for people who do provide that care, very early on, we started thinking about, well, what are some of the individual factors, the personal factors, the skills and abilities that help some caregivers thrive in a situation like that and others become more depleted? So at that point, the conversation had shifted to these blue factors as you see them on the screen. Over time, we have enriched our point of view and have been thinking about how do the yellow factors in this diagram, the systems factors, the organizational factors, all contribute to clinician well-being or the lack thereof. Now, in 2019, the NAM, or National Academy of Medicine, came up with a new model. And in this model, they meant to call more light to those yellow factors in that previous diagram. Here, they were trying to show the effects of systems on work system factors that then are mediated by an individual. So in this diagram, you read it from left to right, from the large circles on the left side with frontline care delivery, the culture within healthcare organizations, and then external environmental factors that all create work system factors that impinge upon the individual care provider. In this model, you can see how it captures that sense that clinicians have, that they feel like they are the last line of defense between the system and providing compassionate care for patients. So this model is very helpful for advancing the conversation because it calls attention to certain things, like the fact that self-care alone is necessary but not sufficient on its own, because it doesn't account for other things such as power imbalances or deeply rooted inequities that are inherent in the system. At the same time, it doesn't quite explain how can individuals help to affect change in the system. In other words, how might an individual read this chart from right to left? Individuals contributing to what the work factors are, and therefore having the chance to change systems at a larger level. Unfortunately, during the pandemic, with its intensity and its stressors, the conversation about clinician well-being sometimes gets construed as an either-or proposition. Is it self-care that we're supposed to do to make things better? Or are we supposed to change the system? And by the way, who does that, right? So that way of constructing the debate in some ways invites polarization, which we see all too much right now in our public discourse. And so in this panel today, what we like to do is explore the both and, to explore the middle ground, so to speak. Now, there's plenty of room within the middle ground to disagree, but our panelists today will help us understand that better. Dorrie Fontaine is an experienced trauma and ICU nurse, and she was also a longtime dean here at the School of Nursing. And she's going to share with us her perspective on healthy work environments that goes back to her days as president of AACN. And she will also talk about how self-care fits into that picture. Ashley Hurst is a clinical ethicist, and she also teaches healthcare ethics at the School of Nursing. She will share her perspective on how well-meaning messages from leaders sometimes can be heard differently than they're intended. When a leader asks clinicians to take care of themselves, sometimes clinicians hear it in a different way. Julie Haizlip, an experienced pediatric ICU physician, also on the School of Nursing faculty, will share her perspective on how clinicians can experience mattering at work. And time permitting, as a leadership communication professor, I will take some time to share my perspective on influencing change with compassion. So from here, let me hand things over to Dorrie. And Dorrie, you've been thinking about this longer than any of us. Yeah. And I wonder if you could tell us a bit about your experience with healthy work environments and self-care and how that all came together for you in your recent book.
Yeah. Great. Thank you, Lili. I would first like to start and say congratulations to Justin Mutter. This is his first Medical Center Hour, and I hope he will enjoy it and bring us great programs for the next 50 years. So, and thank you, Lili, for that beautiful introduction. This is my favorite topic. This has been my life's work, trying to foster well-being across interprofessional formats. And today I'm most interested in self-care and healthy work environments for nurses. Everybody asks me, as well as my meticulous editors, Tim Cunningham, who's now at Emory as Director of Patient and Family Experience, and Natalie May, who started the Center for Appreciative Practice here many years ago and is on the School of Nursing faculty now. So many ask us, wow, why did you write this book? So timely. Well, the fact is we did the proposal in 2019, a whole year before the pandemic. Weren't we right on top of things? And the reason we wrote it is because of the suffering that we see. Lili identified it right off the bat. But I would like to say that this new suffering we see, over 1,000 nurses have died. Nurses are the healthcare workers, the largest group who have passed away in the pandemic. But we've had old suffering, as recently as 2 years ago, 39% of ICU nurses said staffing was not adequate. Guess what they're saying now? 90%. We have new suffering on top of old suffering. And I wanted to be very clear when people say, we'll have to go back to the good old days. Actually, nurses would like a new day. And I think it can be accomplished with self-care and looking at healthy work environments. We also wrote it because all of us have been teachers of nurses and physicians as well. And we have watched the sadness and the disappointment as our new grads go out into the workforce. And my faculty at UVA have often received calls from numerous people about what can they do? They didn't think it would be like this. So as we watched that, we decided to go ahead and look at how we could really provide a compassionate care for patients by focusing on the well-being of our new nurses as well as students. So we decided to start doing retreats. And, everybody didn't jump up and down in the beginning, but now they're popular. There's one going on right now. Second, third, and fourth year students, perhaps, I'm not sure which group, but they're all out at Morven. And these retreats focused on self-care. And for some students, it was the very first time they really took time for themselves. What does it mean to look at yoga, meditation, mindfulness? And we really talk about mindfulness as strictly paying attention. It really is having a focus, pay attention. So these retreats, we do a little bit of all of it. Mindful eating, yoga, journaling, reflection, a little bit of meditation. I know these teachers and they're all brilliant. Jonathan Bartels is often one of them, who has developed the pause, which is a metaphor for really how we should all be living in terms of noticing and pausing. So we teach tools for resilience. We introduce them to the students into the curriculum, and they all want more. And so I think that's one of the things that we should be very proud of. I've done a lot of this well-being work across the country. I just recently finished in the state of Wyoming healthcare workers. And I learned lots of techniques from them, as well as rewiring resilience, we called it. And one of the things was PBR, and it's not a beer, Pabst Blue Ribbon, it's pause, breathe, repeat. And so it's these simple things that we are teaching. And we're also linking to our colleagues in Wisdom and Wellbeing, who are really doing a really tremendous job with all these techniques. So all these national studies have said that staffing is the #1 issue. Well-being is right up there with 3 national polls just in the last week. That is really heartbreaking. Nurse managers now are citing a huge percentage of them are emotionally unhealthy. And in a healthy work environment, it depends upon these leaders as well as the individuals that go into the healthcare work setting. So the healthy work environment came right out of our approach, looking at what is compassionate care. A healthy work environment has 6 standards. The link is aacn.org, and it's been going on for over 15 years. Communication, collaboration, appropriate staffing, meaningful recognition, which is one of my favorites. It's not a bag on Nurse Day. It's every day, how do we meaningfully recognize each other? And Julie is going to talk about her brilliant work on mattering, which is real scholarship plus practical tips. And then finally, authentic leadership. You know, it kind of breaks my heart that our leaders are also feeling unwell. So how can the emotionally unhealthy guide new nurses and seasoned nurses who are desperately looking for some new leadership? So the title of our book, I had hoped, would be Caring for Ourselves so we can better care for others. But it really doesn't matter when you're the editor, the publisher chooses the title. And so it's now about self-care for new and student nurses, as you see. But I'm very proud of all of these authors. You can see the list here, UVA, non-UVA, and they really put their heart and soul into the scholarly pieces of self-care. And I wrote a chapter on how to pick a healthy work environment, which I used to teach every 4th-year student before they left. So there's really no shortcuts to self-care. I think we're one of the only schools in the nation that is really looking at and putting it right in the curriculum. It's as important as any other clinical day. And I look forward to listening to my colleagues talk more about how self-care is important, but it is never enough. In fact, last year in a medical center hour, my dean's successor, Pam Cipriano, said just becoming resilient is not enough in an inhumane healthcare system. We need a lot more nourishing and nurturing of all staff, all colleagues. So I'm now going to turn it over to Ashley Hurst, who she has made this some of her life's work, looking at systems and how we can be better. So Ashley.
Thank you, Dorrie.
You're welcome.
You can see with this slide, one of the things that my focus is on is understanding that spotlighting the importance of self-care practices, which I fully am supportive of, can have the unintended consequence of either obscuring or casting a shadow over the system issues that are related to healthcare provider burnout and exhaustion, and the challenges that healthcare providers are facing to maximize their well-being. And this slide is actually from the National Academy of Medicine's 2019 report that Lili referred to earlier. And what it demonstrates on one hand is job demands. And I think we're going to try to drop this into the chat, a link to this document in case you want a copy of it, is the job demands that are leading towards clinician and healthcare practitioner burnout are things like excessive workload, inadequate staffing, administrative burden, inadequate technology, time pressures, moral distress, among others. And these are systems problems that cannot be solved by individuals and certainly can't be solved by self-care practices for individuals. And so for me, one of the messages that we need to send is both the importance of self-care practices and the importance of system change. Because if we leave out the system change conversation and only spotlight self-care practices, the unintended message that can be heard is that individual healthcare practitioners need to fix themselves. That if they're feeling burned out, exhausted, depressed, angry, and frustrated, that if they double down on their self-care practices, that will address their burnout or address their feelings. And while there's certainly self-care practices are super important, when you recognize that the factors contributing to burnout are these types of system factors, we need to communicate well to our healthcare practitioners that you are not what is broken and you are not what needs to be fixed, that self-care practices enhance your well-being, but there is a system need to address these job demands that are leading to burnout. The other piece of this is also, while resiliency is part of our sort of common language these days in the healthcare arena, and resiliency is such a positive trait, I always stop and ask myself, what are we asking healthcare practitioners to be resilient for or from? If it is to be resilient in the face of the modern healthcare workforce of complexity and fast-paced healthcare delivery, that's one thing. If we're asking our healthcare providers to be resilient in the face of excessive workload, inadequate staffing, patient violence, interprofessional or lack of interprofessional respect and dignity, then we're asking too much of our healthcare workers. Right? That to ask them to be resilient under, as Dorrie just said, Dean Cipriano had mentioned, to be resilient in the face of inhumane conditions is not what we are asking or should be asking for our workforce. So I think one focus for me in the both and of the conversation needs to be highlighting self-care practices for all healthcare practitioners, and at the same time, highlighting what is the work that is being done to address these types of job demands and structural problems that are leading to burnout and frustration and depression and other things that steal the joy out of being a healthcare worker, pandemic or no pandemic. And so fortunately, not just in the National Academy of Medicine report, but in the work that Dorrie and Lili and Julie have been doing, many of which is listed under the job resources on this slide, are ways to help the system structures as well to address these system problems. So I'd like to make sure Julie has time to raise her issues.
Thank you, Ashley. So I'm actually going to leave this very same slide up here because I think one of the things that's really interesting here is that and actually something that I hear very frequently in this conversation is about clinicians reconnecting with the meaning and purpose of their work. But in the research that I've been doing, people can very clearly articulate the meaning and purpose of their work, and yet we're still burning out. And so this is something that has kind of set me along the research that I do. And the meaning and purpose of the work that I'm doing is I want us to get us to a point where we're not just creating systems that don't injure people, but we're actually creating systems that nourish people and putting our healthcare professionals in a place where we can actually leave at the end of the day feeling more vitalized and engaged than we did when we showed up in the morning. And I realize that that has the potential to sound tone deaf in our current situation, but it's my aspirational goal. And I do think it's something that is possible. And so I want to take this moment to introduce the idea of mattering and a culture of mattering. So mattering, as it was first described, is the feeling that we are making a positive impact in the lives of others and that we are somehow significant in the world around us. And when I first heard about this back in 2014, it really resonated because this is what we want to do as healthcare providers. We want to make a positive impact in the lives of others. And we also want to feel significant in the work that we do. And my colleague, Isaac Prelatinsky, who's actually the person who introduced me to this, has kind of simplified this definition into something that I think makes a lot more sense on the surface. And that's the idea that we want to add value and feel valued. And I think that this is a really important distinction, and I find it separate, related, but separate than meaning. And part of the reason I feel this way is because when we've been interviewing the people in our research, we ask healthcare professionals about the meaning of their work, and they can very clearly articulate it. But there's a subset of the people that we speak to where we say, well, tell me about a time when you feel like you mattered at work. And they say, I can't remember the last time I felt like I mattered. And to me, that's simply tragic, right? And I think at the beginning of this pandemic, we did feel like we mattered, right? We were exhausted, we were overworked. And I say we, as part of the larger group, I have to say that I personally have not been affected the way that many of our colleagues here at UVA have been. But I think it feels very different now, because now I don't think that we necessarily feel valued the same way. And I think the other part is that we don't always feel like we can add all of the value that we're capable of. So, when we were having shortage, or when we are currently having shortages of beds, having shortages of PPE, having shortages of ventilators, right? And we're in a situation where we don't feel like we can add the value, where we can provide the level of care that we know that we're capable of because of the systems. And this isn't, targeted at any one particular system, but rather the global sense of what we're capable of in our healthcare system right now. When we can't provide the care that we know that we should be able to, it really gets at our sense of mattering. And when we don't feel valued for the time, the effort, the energy, every bit of ourselves that we're putting into the work that we're doing, how can we feel like the work that we do matters? But I don't want to make this sound completely pessimistic, because one of the things that we have found in this work is just how important relationships are. Anytime we hear a story of mattering, and we hear a number of really amazing, poignant stories, they're almost always relational. It's about the connections between individuals. It's about the connections with coworkers. It's about the connections with patients. It's about the connections that we feel with the families of our patients. And even when we have the inherent sense of mattering, when we just know that the work that we did was really meaningful, it usually reflects on some interaction that we've had with another person and positively impacting their lives. And so one of the things that we hear as we do this is how much it means when someone hears from their coworker, I really appreciate what you did today to help me. Or when they hear from a patient just how much their presence made a difference in their lives. And so we have the opportunity amongst ourselves to create a culture of mattering, a place where we let each other know just how valuable we are to one another. And so with that, I will transition over to Lili and let her talk about the role leadership can play in this.
Unmute myself. Okay. Thank you. Thank you, everyone. And thank you, Julie. You know, the thing that has animated me and has been a fascination for me are the ways that individuals can have voice and give voice to one another within organizations. My Darden colleague, Jim Dieter, has actually written a book about this recently called Courage. And I think he goes into it much more than I can today, but I do want to share some ideas with you for those of you out there who are thinking, well, what can I do? What can I affect? I understand that systems have an enormous impact on me, but how can I overcome this sense of powerlessness? How can I actually begin to give voice in a way that's going to be effective and do it in a way that is also compassionate? Because I understand that my compassionate actions towards my colleagues and even my leaders has an effect on all of us. Well, I've been teaching a course the last several years, much at Dorrie's prodding, called Leading with Presence in Healthcare. And in that course, we have conversations just about this topic, about how to influence change with compassion. And I rely on several texts that are shown here on the slide, Monica Warline and Jane Dutton's Awakening Compassion at Work, in which they make the case for compassion at work as a competitive advantage that helps to start a positive cycle of psychological safety that then leads to reduced turnover, to increased productivity and innovation in a workplace. We also look at The Mind of the Leader by Rasmus Hugard and Jacqueline Carter, who look at applications of mindfulness, quieting your ego, and compassion to the tasks of leadership, both managing ourselves and other people. And then we also look at leadership presence as actors understand it, both as a way of getting centered within yourself, dipping into your own emotion, and reaching out and expressing and connecting with other people in a way that shares your values. I would say, if I had to summarize, the way I see the current controversy and misunderstanding that seems to be fairly rife among levels in an organization, my advice might be, if you see something you don't understand, you probably don't know the whole story, right? And so for us to make progress on this, we need to learn how to hear each other's stories. So my advice for any of you, no matter what position you're in, I don't care if you're on the housekeeping staff, I don't care if you are a hospital aide, I don't care if you're a physician or a leader in an organization, I think this advice can apply to everyone. The first thing I would suggest is examine your own reactions and your own stories. When something happens at work, how does that land with you? Does that leave you feeling angry, anxious, upset? Does it leave you feeling beleaguered, downtrodden, burnt out? In either of those scenarios, you will do yourself and others a big service to find your way back into a more resilient place, so that when you do speak out, it is not with ungrounded anger and it is not out of desperation. You will be much more effective if you can find a way to moderate your own experience and get back into that more balanced place. I also ask you to examine your stories. Look at the ways that, especially when we're under stress or feel besieged, we go to the easy and available narratives that are out there for us. Like, oh, well, you know, the reason nurses are so burnt out is because they don't have any power. Or the reasons why doctors are burnt out is because they've got giant egos and they've got God complexes. Or, you know, leaders don't really care, all they care about is money. All of those stories are not helpful for getting past impasses. And so I'd ask you to ask, what part of the story do you not understand that will help you have a more complete and more balanced view that will help you move forward? I'd ask you to ask each other powerful questions, and that when you do, you listen with goodwill. Asking a powerful question can get to the heart of a matter, especially when it's done respectfully. It can be tremendously effective. And making a pledge to listen with goodwill builds respect, builds trust between different parties. I'd also ask you to give grace. Just as you like other people to cut you some slack, how about doing the same? If we can give each other grace, understand that we're all under stress. We're prone to make mistakes under stress. And that with forgiveness and understanding, we can learn to do better. I also ask you to think about things like moving outside of yourself and finding allies. How do you find others who can help you have a stronger voice, either by lending their support and encouragement, or perhaps amplifying your voice? There might be ways to work across differences or to co-create alternatives. And together you might learn how to skillfully influence other people to bring them around to your way of thinking. I think in the current circumstances, it's wise and healthy to expect that big change really often comes from a lot of little changes, a lot of small conversations that add up into collective action. And that's really where it's at. If the system were as easy to fix as flipping a switch, I think it'd be done by now. In fact, it's going to take the coordinated action of many people across layers in an organization, across professions, across differences to come to new ways of operating. I think baking in well-being into our systems is probably where we would be best served right now. Yes, self-care is very important. And as you're seeing with my advice, it's, you know, it takes a lot of resilience to do the hard work of leading systems change. But at some point, we have to shift the focus from the individual to the system itself. Are there ways that we can re-examine staffing loads? Are there ways that we can re-examine shift work? Are there ways that we can re-examine the allocation of resources and the giving of rewards in such a way that it rewards the behavior that we want to see, which is having people care for themselves so they can care for other people? Now that's going to be a collective effort. There is at least a belief that leaders have an outsized influence on this process. But in some ways, we all contribute to it, at least at the level of creating culture. And lastly, this is hard work. So do keep in mind that you might need to draw back to leap from time to time. You might need time for a retreat, to take time for yourself so that you can come back at it another day. That's actually healthy. That's actually very adaptive. So give yourself a chance to do such a thing. So I'm watching the time, and one of the things we're quite committed to here is being able to give the audience time to ask their questions. And I know that, Justin, you have been keeping your eye on the question and answer box. And If any of you are still in the process of getting your questions in, please go ahead and add those now. Let those pour in. And Justin, I will hand it over to you to pick among the questions that you think would be most valuable to answer.
Thank you so much, Lili, and thank you to all of our panelists here as we move into question and answer and just conversation about all these really important topics. So our first question is from a first-year medical student mentioning that in our orientation, we heard multiple times that as a new generation of healthcare providers, we need to make changes within the system, such as debriefing adverse events and et cetera. How do we navigate this responsibility without overstepping what seems to be the bounds of a student when the medical model across health professions is hierarchical?
That's a great question. Who among us wants to jump at that? Julie, you've been a medical student. Dorrie, you were raising your hand.
Dorrie, why don't you take it first? You're muted there.
Okay, I'll go first and then you. Part of, I'll use the word training, students in self-care is so that they really understand themselves and have the courage to speak up. And I think this goes for nurses as well as medical students. Of course, they always feel like they're at the bottom of the pole, but with courage and asking the right questions, as you point out, Lili, they can really rise up and say, I just watched something and it didn't seem right. So let me be able to form a question. And we certainly taught that in our clinical nurse leader courses. But I often tell everybody that it's their role to speak up, as Martin Luther King says, when we don't speak up about things that matter, a little of us kind of dies. So pretend that it's your mother in that bed, for example, and you think that they might be missing something. You have to speak up whether you're brand new or very seasoned. So Julie, go ahead.
Well, first of all, I want to acknowledge the question. Having been a med student, I certainly understand, and this is something that Ashley talks about a lot, the power of the power differential, and when you feel like you're on the bottom end of that, how hard it is. And my answer is remarkably similar to what Dorrie has said, and I think my friend and colleague Peggy Pluzogan is actually on the webinar, but one of the most important things that she taught me was around this idea of curiosity rather than judgment. And I think no matter what position you're in terms of a power differential, curiosity is perhaps one of the most underrated virtues. And to be able to come at a situation saying, clearly this is not how any of us would have liked for this to happen, right? Because I don't think anyone comes to work today saying, today, I think we should have a systems issue that makes it really difficult to care for patients, right? So the question is, in a broad sense, how could this have been better? What could we have done? What would you as an individual, speaking to the nurse, speaking to the doctor, speaking to the respiratory therapist, speaking to anyone and everyone involved, how could you have seen this being done better or differently that might have given us a better outcome? And it's not a blaming game. And I think that that's one of the most important things, is that, no one in healthcare comes to work to try and do things wrong or to make things more difficult or to be a barrier. And so the question is, such as it is, how might we have been able to approach this differently? What are you seeing from your perspective that maybe I'm not seeing? One of the things that I've been very interested in is interprofessional education and collaborative practice. And, I've worked in the medical school since 2003. I've worked in the nursing school since 2014. And I thought as a physician, I was very interested and honed in on how my nursing colleagues, and I have a background in pharmacy, how my pharmacy colleagues were looking at the situation. But the more that I become enmeshed in the nursing culture, the more I realize I didn't have a clue. And so using the opportunity to hear other people's perspectives. And I think that perhaps is easiest to do when you're a student.
Ashley, how would you answer this question?
I would echo everything that Dorrie and Julie have said. I do think in the student role, you are both feeling very keenly the power differentials, but you also have this golden opportunity that you probably never will have again to express that curiosity as true curiosity, as a true learner, and approaching a situation where you are thinking, what happened here? And it feels wrong or bad, or I am confused, but approaching it with, how can you teach me? Right? Can I ask the question in a way that is truly curious as a learner? I find that that really does diffuse some of the power differentials, because the person you're asking the question of doesn't feel attacked or doesn't feel that they need to justify actions. They're in teaching mode. And I think maybe because I am a teacher, that I find my best self is when I go into teaching mode. That you as a medical student, when you are asking a curious question, can diffuse some of the difficulties around a case that maybe didn't go well, and that there is some tension around asking questions about it.
Yeah, let me quickly add to that. You know, a lot depends on your delivery, right? When you're asking a powerful question like that with a genuine sense of curiosity and a desire to understand, that communicates a lot about your intent, right? Questions that start off like, well, what do you mean we're doing blah, 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 right? You know, that is just not the way to, you know, the old Southern thing, you know, catch more flies with honey than vinegar. So the thing that I would add to this discussion is that, yes, it does feel risky sometimes to be the lone voice. So don't go it alone. The truth is that sometimes whistleblowers do end up getting singled out, and sometimes there are negative repercussions, unintended, obviously, by the person who brings them up. So there is safety in numbers. Begin to talk with colleagues. See if you can raise the question not on your own, but with a group voice, and that may help you find the holes in your own argument, come up with a better way of asking the question, at least with numbers, get a different hearing.
So our next question from an attendee is about gender inequities and how that affects the experience of burnout, and also ways in which we can advocate for change. The attendee writes, healthcare fields in which there is a preponderance of women are underpaid. Can you talk about how that affects burnout and what the best ways are to advocate to minimize that inequality without worsening burnout?
Ashley, that sounds like a question up your alley.
So it's an incredibly important question, and I'm not sure I have a solution, but I think paying attention to what the writer is calling out is the work of our institutions, in the fact that there are these inequities around gender. And when you have a very gendered workforce, which, for example, nursing is still very gendered, that they have a tendency to be way underpaid in connection to other professions. And that sense of communicating to a workforce or a group that your value is less because we pay you less is very destructive. And it does contribute to burnout, and it contributes to inequities. We also know, just from a cultural standpoint, that many women carry childbearing or child raising roles, as well as caregiver roles for elderly parents or others, They do a lot of emotional labor and uncompensated labor in addition to the work that they do for their healthcare organizations. And so I think that it is something that healthcare organizations around the country can be paying attention to, not just with support for, say, childcare or elderly care breaks and stipends and making these things available, but really thinking about what are the ways that we can help our workforce, recognizing the additional responsibilities our society has put on, in many ways, women, but not only women, but persons in our society who are carrying these uncompensated roles to some extent unfairly. And I also think that pay is important. I had the luxury of being a lawyer for most of my professional life, and we get paid fairly well. And I think that that is something that we say to people when we pay people well. We communicate to them that you're valuable and necessary. And when we don't pay people well, we send the opposite message. And so I think it is important for healthcare organizations to pay attention to that.
Could I add to that? About 10 days ago, the University of Alabama had 24 healthcare workers standing on the street refusing to clock in because all the states around UAB in Birmingham all paid 8% higher, which might not seem like a lot, but they viewed it as, you know, their colleagues going to another state to make a little bit more money, or maybe a lot more. It was a group, it included some men, I was happy to see, and many underrepresented minorities. The chief nurse came out at midnight, a few hours after they were supposed to all clock in, and made an announcement that it's the first thing they're going to look at, and et cetera, et cetera. But I think Ashley is absolutely right. And we need to find these allies, like you've been saying, Lili. So I'm going to stay tuned. I don't do Facebook or anything, but I got to find out the bottom line on that story. Advocating strikes, by the way.
Thank you, Dorrie. We have a few more questions coming in, and we'll do our best to get through as many of these as we possibly can. We have about eight minutes left, 7 or 8 minutes. This next question is about seeing the alternative. So the attendee writes, I'm looking for some hope that the system can indeed change. Would you have some examples where the system has changed in a way that promotes flourishing?
Well, this example does not come from healthcare. It actually comes from the natural world. And some of you may know the story of the reintroduction of wolves into Yellowstone Park. Do you know this story, right? So there was a time in which the wolves were seen as an enemy of the wildlife in the park. And so there was a mass shooting, killing of and removal of wolves. But in that time, the ecosystem changed. And the ecosystem actually ended up producing an imbalance in the wildlife that removed quite a bit of vegetation in the park. That put the park at a greater risk for fire. And as a result, there were wildfires that destroyed much of the habitat. Well, the idea was that this is a system, it's an ecosystem. What if we reintroduced wolves? Wolves were reintroduced. In that time, the herding animals were kept under control by the wolves. As a result, vegetation came back and there were fewer wildfires. So I share this as a simple example, maybe one outside of healthcare, that illustrates how one small change can have a systems effect. Now, what will be that one small change in healthcare? I think we're all staying tuned and want to know. Will it be changes in Affordable Care Act? Will it be changes in the way we do staffing and compensation? Will it be changes in some other thing? It's hard to know. But I do know that it will be difficult to change a tired and exhausted ecosystem without some new ideas. And the new ideas have to come from somewhere and somebody's energy. So we hold out that great hope.
I could say, I think my organization at ACN Critical Care does have good examples of changes that can be made in the healthy work environment, even though that they're stating that their leaders are pretty exhausted as well, but they are collecting stories of good things that can be done. So I would suggest that you look at some aacn.org. They are, also saying, along with other healthcare providers, that, 66% are considering leaving after the pandemic, leaving the profession. So a lot of these things are scary. Institute for Healthcare Improvement also has, what's the pebble in your shoe? What's the one thing you can change? But you do have to feel intact with yourself and have strategies for self-care to really ask those good questions.
And I would add that if people are looking for specific examples of health systems that seem to be making change at the systems level, places where Tate Shannenfeld has worked, the Mayo Clinic, and now at Stanford, are good places to look for role models, because the treatment there of well-being is not confined to a wellness program or resiliency program, but it has been baked into the system of the organization from soup to nuts. So those would be good case studies, I would think, to look up.
I realize that we're about to run out of time, but I wanted to mention a couple other things. First is that there was an article that just came out in this month's Annals of Internal Medicine, or I think that's what it was, that was addressing some of the changes that perhaps could happen, at least right now, to lessen the burden on some of the care providers. Things like, backing off some of the mandatory annual retrainings that take a lot of time, and at least right now don't seem to be mission critical. Things like having some flexibility around scheduling that would allow people to deal with some of their childcare issues. And so some very concrete, specific examples that we may not have seen implemented yet, but these things take time. Even once they're implemented, it takes a little while to see the difference. But the other thing that I would mention, and Dorrie won't mention it because she's modest, but thinking about when Dorrie was here as one of our leaders, one of the pebbles in people's shoe was this idea that they were getting emails on the weekends and at night and feeling like there was this undue expectation of them to be working during their personal time. And I think I've heard this from people in the hospital who are constantly getting called and asked to come in on their days off. And so one of the things Dorrie put in place was a standing expectation. You are not required to, you might get emails on the weekend, but you're not necessarily required to respond to them. You can wait until the next day you're supposed to be there and respond, and that would be what our expectation would be. And it seems like a very minimal change, but what that did to people's attitudes about how to respond to these things was really significant in our environment. So a very simple change in the system that made a very big difference to the people within the system.
Thank you, Julia. So, and apologize that we're out of time. I know there are several other questions in the chat. Sorry, we did not get to those. But I will say this, this is a conversation that begets many more conversations. And these are discussions that we need to be having with one another, with our friends, our colleagues on a daily basis. We're all in this together. And so certainly invite you to continue these conversations with those surrounding you. Let me thank our panelists for their time, their expertise, their wisdom. This has been a wonderful discussion. And again, hopefully a discussion that continues for many of us. A reminder for our attendees that you can claim continuing education credit. And please join us next week, same time, same Zoom link, for a presentation of national resonance from Dr. Rebecca Etz. where the sidewalk ends and where primary care begins. Next week's Medical Center Hour will be co-presented with UVA's Generalist Scholars Program and falls during our celebration of National Primary Care Week. So thanks to you all, and we'll see you next week.
I have a question if we could talk.
Richard, are we clear?